It is Monday, February 20th, 2023, and today a report was released from Nature that showed that a fifth person was cured of HIV. Let's break this study down and understand exactly how this could have happened. Today's breakthrough adds to decades of research and prior breakthroughs in the attempt to find a cure for the treatment of HIV. And in this particular case, a 53-year-old male who previously had tested positive for HIV was also unfortunately diagnosed with leukemia in 2011, and after that diagnosis, he received chemotherapy as well as a stem cell transplant. Now, what's interesting in this particular case is that this stem cell transplant came from a donor who was resistant to HIV. Some of you may not know, but there's a small percentage of the population that we clinically deem as resistant to HIV. This percentage of people don't have the receptors necessary for HIV to bind onto, which causes infection, rendering them resistant to HIV infection. After chemotherapy and the stem cell transplant, this patient began to develop new healthy cells without detectable signs of the HIV virus. Although this is a good outcome for this patient, he was kept on HIV medication up until 2018. In between the stem cell transplant and 2018, he was continuously tested to detect for possible signs of replicating HIV virus. And in 2018, after careful consideration, he was taken off the HIV medication, and since that time has been extensively tested and not been found to have any detectable signs of the HIV virus. Now, of course, again, this is a great outcome, but this is likely not an option for most because stem cell transplants don't come without risks. The chemotherapy needed to help remove the disease or malfunctioning cells prior to stem cell therapy can suppress the immune system, making patients susceptible to infections that can be life-threatening. Also, there's a chance that after the stem cell transplant, patients can reject that stem cell transplant, and that can also be life-threatening. So unfortunately, we'll still continue to await for research to try to find a cure that comes without these types of risks. But that doesn't discount all the effort and work that has been done to advance the treatment of HIV. Today, thankfully, due to medications, people with HIV can live long and healthy lives. And also, thankful to medications, those with HIV who consistently take their medications and are undetectable cannot transmit it to their sexual or intimate partners. We also now use medications to prevent the transmission of HIV, called PrEP, for example, or pre-exposure prophylaxis. It's a medication that, if taken regularly, can substantially reduce one's risk of contracting the HIV virus from sexual intercourse. We also have post-exposure prophylaxis, meaning those who are HIV negative, who have a high-risk exposure, can take these medications close after that interaction to, again, reduce their risk of contracting the virus. I'll continue staying up to date on this story, and until then, leave your comments and questions below. Have a great day, everyone.